morning. I am Devasena. In this lecture, we are going to discuss about ventilators. This topic is present in the subject Medical Electronics. Ventilator. For reduced breathing or respiratory failure, that is insufficiency, mechanical devices or respirators are used in hospitals. These devices provide artificial ventilation, supply enough oxygen, and eliminate the right amount of carbon dioxide. They maintain the desired atrial partial pressure of carbon dioxide, that is PCO2, and desired atrial oxygen tension, partial pressure of oxygen. Ventilators are also used during anesthesia and are designed to match human breathing waveform pattern. This sophisticated equipment with a large number of controls which assist in maintaining proper and regulating human activity. For short-term or emergency use, respirators are used. These depend upon mechanical cycle operation and generally lightweight and portable. Let us discuss about inspiration and expiration process through the nose. Here is a representation of the flow of air to the lungs through the nose and removal of carbon dioxide from the lungs to the environment through the nose. Here is a representation. Inside flow of air is called as inspiration. Removal of carbon dioxide from the lungs through the nose is called expiration. Here is a representation of movement of diaphragm inside our body due to air circulation in the lungs. Due to the passage of air inside the lungs, the diaphragm moves ups and down inside our body. This is represented here. The expansion and contraction of the rib bones occur due to the passage of air. Bag valve mask, BVM. A bag valve mask, sometimes known by the proprietary name Ambu bag or generically as a manual resuscitator or self-inflating bag, is a handheld device commonly used to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. Bag valve mask. The mask is of soft rubber or plastic, is held firmly over the patient's mouth. The breathing valve serves to guide the air so that fresh air or air enriched with oxygen is supplied to the patient and expired air is conducted away. The bag is squeezed with one hand and functions as a pump. It is self-expanding and fills automatically with fresh air or oxygen and when the patient breathes out. Bag valve mask representation. This is one way of representing bag valve mask. Here is another representation. Function of the ventilator. The main function of a ventilator is to ventilate the lungs in a manner as close to natural respiration as possible. Since natural inspiration is a result of negative pressure in the pleural cavity generated by the movement of diaphragm, ventilators were initially designed to create the same effect. These ventilators are called negative pressure ventilators. Ventilator setup representation is shown here. Here, the mechanical ventilator is connected to the patient. This mechanical ventilator provides air or air with increased oxygen through the tubes into the patient's airways. From the ventilator, air flowing to the patient passes through a humidifier which warms and moistens the air. It is passed to the endotracheal tube. This endotracheal tube goes through the patient's mouth and into the windpipe. Nasogastric tube goes through the patient's nose and into the stomach. The exhaled air flowing away from the patient. The nurse periodically checks the patient. This is represented here. Ventilator GAF representation is shown here. Here, with the help of the ventilator, air is passing into the patient's lungs. We are having 4 representations. The first one in the graph represents peak inspiratory pressure. The second represents fluid pressure. The third one represents the driving pressure. Fourth one represents the positive end expiratory pressure. Open circuit ventilation representation is shown here. In this circuit, from the open circuit ventilator, fresh gas flows into the humidifier through the inspiratory valve. From the humidifier, this fresh air passes to the patient through the inspiratory arm, and this fresh air passes through the lungs of the patient, and the expiratory arm sends the expiratory gas, that is the carbon dioxide, through the expiratory valve, and through the filter it comes out. And here the inspiration as well as the expiration graph is also represented in this diagram. Closed circuit ventilation representation is shown here. In that closed circuit ventilator, the expiratory gas is taken, that is passed to the carbon dioxide absorber. This carbon dioxide absorber absorbs the carbon dioxide that is present in the gas, and we have the oxygen rich gas. That oxygen rich gas is passed to the humidifier through the one-way valve, and from the humidifier it passes to the patient through the inspiratory arm. This fresh air reaches the patient, and the expiratory gas is releasing from the patient through the expiratory arm, and this expiratory gas once again reaches the closed circuit ventilator for next recycle process. This process goes on continuously. This is represented here. Types of ventilators. First one, anesthesia ventilators. These are generally small and simple equipment used to give regular assisted breathing during an operation. The second type is intensive care ventilators. Intensive care ventilators are more complicated. They have accurate control over a wider range of parameters and often incorporable patient triggering facility. That is, the ventilators deliver air to the patient when the patient tries to inhale. Positive pressure ventilator generates the inspiratory flow by applying a positive pressure greater than the atmospheric pressure to the airways. During the inspiration, the inspiratory flow delivery system stops the positive pressure in the patient circuit, and the exhalation control system closes the outlet to the atmosphere. During the expiratory phase, The inspiratory flow delivery system stops the positive pressure at the exhalation system and opens the valves to allow the exhaled air to the atmosphere. Positive pressure ventilators have been found to be quite successful in treating patients with a wide range of pulmonary disorders. In general, most ventilators in clinical use employ positive pressure during inspiration to inflate the lungs with mixture of gases, that is air and oxygen. Expiration usually positive, though under certain conditions pressure may have to be applied during the expiratory phase in order to improve atrial oxygen pressure. Block diagram of a ventilator with its accessories is shown below. We will discuss each block in detail in the further slides. During patient inspiration, the air compressor draws room air through an air filter and passes it to the main solenoid. Main solenoid forces the bottom inlet valve of the internal bellows chamber to open and the lower outlet valve. Oxygen is passed into the bellows chamber in a controlled manner by means of a control valve. The high pressure in the bellows chamber compresses the bellows and forces the upper outlet valve to open. Thus, the compressed oxygen-enriched air is passed through main solenoid into the external tubes and then to the bacterial filter, humidifier, nebulizer, and finally to the patient's lungs. Humidifier. In order to prevent damage to the patient's lungs, the applied air or oxygen must be humidified either by heat vaporization, that is steam, or by bubbling an air steam through a jar of water. Nebulizer. A nebulizer compressor produces a fine spray of water or medication into patients' inspired air in the form of aerosols. In a nebulizer, the water or medication is picked up by a high velocity jet of oxygen enriched air and thrown against one or more baffles or other surfaces to break the substance into controllable sized droplets, which are then applied to the patient. A sensitivity control monitors the negative pressure necessary to initiate inspiration when the ventilator is used in assisted mode. An aspirator or other types of suction apparatus is often included in a part of the ventilator to remove the mucus and other fluids from the airways. When the medicated air is forced into lungs through valve number 1, the spirometer is in closed condition. When the inspiration is complete, the main solenoid switches the direction of the pneumatic air to do the expiration cycle. Spirometer. It is used to measure the volume of exhaled air so as to give an alarm to stop expiration and to initiate inspiration in the ventilator unit. During expiration, the air is sucked into the spirometer chamber through the valve number 1. The volume of the chamber is varied by means of a lightweight piston that moves freely in a cylinder as air is withdrawn. A elastic rubber seal between the piston and the cylinder wall keeps the chamber airtight.
Thank you very much for listening this lecture. For further updates, kindly subscribe this channel. If you like this video means kindly Share this video to your friends. Thank you.